So like I said, one of the main indicators, Paridhi, is that your tests don't match up. So if you're using different diagnostic tests and you see that the result on one test is completely contradictory to result on the other test, that is one of the red flags that you should look out for, that your patient is lying because one test is showing completely different to the other test. The other thing that we and in our university years were taught to look out for was that, but I haven't really met a lot of patients with this ability of calculation, is that if you see perfect scores on tests, so for example, you see a patient who very clearly is depressed, but you see that the score on a depression inventory is completely showing no depression at all. Or on the contrary, you see somebody who appears completely fine but is having very high level of depression, very very strong, almost extreme, what we say, clinical depression. Then that should be an alert for you that something is wrong. Either the patient has some attention seeking behavioral problems and is trying to lie on the test to actually make you believe that they are much more depressed than they actually are. Or vice versa, you can have a patient who very clearly appears depressed but doesn't want to admit that they are, so they tend to downplay their depression. We call this the social desirability effect. If there's any social psychologists, they'll know. It is basically what psychologists believe is your desire to appear perfect in society, and not accept that you're having these mental issues. And many patients have an ability to manipulate and lie on tests. So of course there is one thing which is relying on tests, and the other thing is your professional opinion as well. If you feel that there is a patient who is very manipulative and who's beating around the bush, it's been 5 sessions, 6 sessions, they're not really talking about anything significant, they keep going on about very superficial things, but you feel that there is something in the background which is bothering them, but they're not letting you into that part, or they're not coming out and saying what it actually is. Then Rorschach is a very good test. So I would say two things. One is use testing and see if your tests give contradictory answers, and two is obviously your professional diagnosis as a therapist. Also your professional reading or your professional opinion of a person, of a patient, being completely repressed and not really allowing you to tap into what's actually going on in their mind, then Rorschach is very effective.